As we talk about reopening the state, how do we know what's safe? I'm joined by Dr. Akiko Iwasaki. She is an immunologist at the Yale School of Medicine. Thank you for being with us again, doctor.
Thank you, Kara, for having me.
So let's talk first about the antibody test. It's widely available, but if we end up having antibodies, what does that actually mean?
So antibodies are something that our immune system makes in response to viruses and bacteria and so on. And so it indicates that somebody has been exposed to the virus and has mounted an immune response to the virus. However, it doesn't necessarily mean that you are protected from further infection with the virus or that you are no longer transmitting the virus. There are some people with antibody that still have virus in their nose. And so it's unclear whether the antibody alone tells you about how infectious you are or how protected you are from infection.
And what about these newer symptoms like COVID toe? Some people are noticing some blue spots on their toes. Some of these children who are getting sick and they think it's related in New York. What about these new symptoms?
Right. So this disease is kind of surprising us on a daily basis. New symptoms keep coming up, and this is one of the latest thing that people are getting these COVID toes, which are sort of purple or red swollen toes. It's quite painful. And children are also getting even more systemic inflammatory diseases, potentially as a result of the COVID-19 exposure. And there seems to be some delay in the onset of these types of disease compared to fever and cough that may occur earlier. So the scientists are trying to scramble to try to figure out what is causing these types of symptoms and how we can help these patients.
Based on where you sit as you're watching this virus, do you think it's okay to start opening things back up?
Right. So there's a lot of, drive, obviously, from everyone in the community to open up the society. And there are plans in place at the statewide level, as well as in some local community to open up parts of that society. And I think it has to be done very carefully. So we can't really go back to life as we knew it before the March timeline. For instance, we still need to practice social distancing measures, keeping 6 feet away from others, as well as wearing masks and washing hands and doing all the precautions that we had discussed earlier to protect yourself as well as others from this infection. And the other thing that would really help with the opening of society is to implement wide testing. I know that there are plans in place to start doing wider testing. Currently, we don't have enough tests to, for general public to be tested. But I'm hoping that in the near future, we can have PCR testing to know who's infectious and who's safe to go back into society.
We've been doing stories on the antibody test being widely available now. And if it doesn't necessarily guarantee immunity, why do you think people should take it? Or do you think you should get it if you can, if you think you might have been exposed?
Right. So it does tell you that if you have a positive response from the antibody test, that you had been exposed to the virus, and that's an important knowledge to have. That you had been exposed and you had recovered from it. Again, with the caution that it doesn't necessarily mean that you are no longer carrying infectious virus. So as long as people understand the caveats, it is an important knowledge to have.
And is it helpful to the society? I'm sorry, is it helpful to the society too, because then the state can track where there's exposure?
Exactly. That's what I was going to say. Exactly. That at the public health level, the people, the society, and also the city and states have to know where the exposures have been. And so in order to contact trace and find out who else was exposed to the virus and potentially test those people. And so having a kind of widely accessible test available, especially for the viral RNA sensing test, PCR, is extremely important for opening up the society.
I want to take some questions from our feed. The governor has said that hair salons will be able to open and nail salons will be able to open in the first wave on May 20th. And there are actually a lot of salon workers who think, how is that possible? How could we possibly be safe if we are touching people? Do you think it's okay to open those now?
um, Again, yeah, it's difficult to obviously have physical distancing if you have to touch your clients, feet or
Right.
hands. Um, Hopefully, they are implementing, universal masks and, gloves and cleaning. Frequent cleaning of surfaces and other things. I don't know what other guidelines are given to these shop owners, but yeah, I mean, still, we really need to be cautious about preventing exposure and transmission.
Yeah. And as we talk about reopening, when we had you on maybe 6 weeks ago, it seems like a lifetime ago, it was right before St. Patrick's Day. And I remember that you said we really need to cancel these parades. And that seemed a little extreme at that moment. And then 2 days later, everything got canceled. And now we know why. But as you look at reopening right now, like, we're all walking around with masks, but we really don't know. They're talking about finding the virus in wastewater. They're talking about how long it lives. Like, I think the last time I talked to you, you thought it could live on a surface for several days. What's the latest that you've learned about how long the coronavirus lives?
Right. So the research that I mentioned last time, the results are actually now confirmed by other studies that this virus can live on the surface, particularly things like plastic, for extended period, up to a couple of days. So I think we still need to be cautious about opening packages and touching again surface that may contain the virus, and using frequent hand washing practice. So those things still remain, and unfortunately, we still need to be cautious of contaminated surface and having to clean them regularly in public places.
Do you think it's helpful to wear a mask? I know sometimes we might not be wearing them appropriately. Give us some advice on wearing masks.
Right. So masks are known to kind of prevent, widespread kind of exhalation of the virus from a infected person. So, for instance, if somebody's infected and are coughing, having a mask will prevent a lot of that from going out and infecting others. But it's not 100%. Safe, even if you're wearing a mask. So masks should be used, but we shouldn't feel totally confident that that's going to protect somebody. We still need to be distancing ourselves from especially infected people. And the people, I've seen people wearing masks and like halfway through the nose, or kind of having half the mouth not being covered. It really needs to cover both the mouth and the nose. And when you take off your mask and reuse it, please don't touch the surface of your hands inside the mask and then reuse it, because that's kind of defeating the whole purpose. So try to be careful about taking off the masks and really not touching the inside until you wash your hands.
Yeah, I mean, I have a cloth mask. I've been washing it with hot soapy water at night, but I worry that sometimes when you take it off, you set it down on something. I know we're not doing it as quite the way they would do it in a surgical situation. I guess you would say it's better that we use them than not use them.
Right. I mean, using masks is likely going to reduce the exposure risk, but it's not perfect. You really need a fitted respirator to really protect yourself, and those are really in short supply, obviously. So we don't advise the public to be wearing those kinds of respirators. One thing that people have done and that works is to put your used mask in some kind of a, I don't know, brown bag. Just close it and leave it for a few days until the virus is no longer infectious. And then you recycle it that way. And people have been doing that. If you have more than one mask, that's
Okay.
something you could do.
I know I've done stories with on bacteria in our common household sponges. They tell us to put it in a little water and microwave the sponge for 2 minutes. Could you, if you have a safe mask with no metal on it, could you microwave it to kill it?
I'm not sure.
Okay.
I haven't heard that before. People are using, obviously in the hospital, they're using chemicals and things to deactivate the virus. Obviously, we don't have that in the household. Probably the best way to do it is, as I said, like the time is actually on our side. So if you let the mask sit in a closed container for a few days, likely there's going to be no more infectious virus.
When do you think we can go back to some sense of normalcy with activities like weddings? I know a lot of people are concerned about things that are planned for the summer. Almost everyone has a vacation planned. Almost everyone might have a wedding to go to, or perhaps they're getting married themselves. Do you see those as being safe activities come summer?
It's really difficult to say. I mean, if I had a choice, I would, definitely do those practice of physically distancing from other guests, wearing a mask. I know it's not going to look pretty as a bride to be wearing a mask, but it's something that I think it would be too dangerous to go out there and have a big wedding without any precaution at this point. That's going to lead to the second wave.
And last question, we're talking about sending kids back to school in the fall. What does that need to look like?
Yes. So I think, again, we need to see how things are going at that point. If we have developed a effective therapy or monoclonal antibodies or vaccines, obviously September would be too early for vaccines. But so if there are measures to tackle the virus in addition to social distancing, that would be, give us more comfort. However, September is really too early for all of these things to be available. So, depends. I mean, some schools are thinking about opening with just an online school. So we'll have to see what happens then.
Yes, I know a lot of this is crystal ball questions. We're going to have to see what happens with the virus and what happens across the nation as more and more states are really fully opening now. I guess it's a little bit of an experiment to see what happens.
I'm very concerned about fully opening without any testing or physical distancing measures. I think that's very dangerous.
Dr. Iwasaki, we thank you. You're an immunologist at the Yale School of Medicine. I know you and your team have been studying how this virus works, how the SARS virus works. So we thank you for your scientific perspective and thank you for being with us.
Thank you so much, Kara, for having me.